Dr. Heinrich Bergmann pressed his blood-soaked hands against the gaping chest wound of the young Austrian soldier lying on the makeshift operating table, feeling the irregular heartbeat weakening beneath his fingers. At 38 years old, he was one of the most skilled surgeons in the Austro-Hungarian army, having performed over 3,000 battlefield surgeries since the war began in 1914. But on this hellish October morning in 1917, as Italian artillery shells crashed into the field hospital with devastating regularity, Heinrich faced surgical challenges that tested every aspect of his medical training and personal courage. The hospital was located in a partially destroyed monastery near Caporetto, positioned just 3 miles behind the front lines where Austro-Hungarian and German forces were launching their massive offensive against Italian defensive positions. The ancient stone building provided minimal protection from artillery fire, with shells penetrating the weakened walls and ceiling to explode among wounded soldiers and medical staff who had nowhere to hide from the bombardment. Heinrich had arrived at Caporetto 2 days earlier as part of a mobile surgical unit tasked with providing immediate medical care to soldiers wounded during the offensive. The facility was primitive even by wartime standards. Operating tables constructed from wooden doors placed across sawhorses, surgical instruments sterilized in boiling water heated over wood fires, and anesthesia supplies limited to chloroform and morphine that were already running dangerously low. The current crisis had begun at dawn when Italian forces, desperate to halt the Austro-Hungarian advance, had begun targeting rear area facilities with concentrated artillery fire designed to disrupt medical operations and supply lines. The bombardment had killed several medical staff members and wounded dozens of patients who were already suffering from combat injuries, creating a catastrophic situation where the hospital itself had become a battlefield. Heinrich's background had prepared him well for the technical challenges of battlefield surgery, but nothing could have prepared him for the psychological pressures of operating while shells exploded around him. Born in Vienna to a family of physicians who had served Austria for 3 generations, he had received the finest medical education available at the University of Vienna Medical School, specializing in trauma surgery under professors who were pioneering new approaches to treating severe battlefield injuries. When war erupted in 1914, Heinrich had immediately volunteered for military medical service, understanding that his surgical skills would be desperately needed to treat the massive casualties that modern warfare was producing. His early experiences at field hospitals along the Serbian and Russian fronts had been sobering, exposing him to the horrific injuries created by high-explosive artillery, machine gun fire, and chemical weapons that were producing casualties at rates that exceeded anything in previous military history. What would you do if you had to perform life-saving surgery while artillery shells exploded around you? The young soldier on Heinrich's operating table had been wounded by shell fragments that had penetrated his chest cavity, damaging his left lung and creating hemorrhaging that would be fatal without immediate surgical intervention. The procedure required opening the chest, identifying damaged blood vessels, and repairing them while maintaining the patient's breathing and circulation. Technically challenging even under ideal hospital conditions, but extraordinarily difficult in a field hospital under artillery bombardment. Heinrich's surgical assistant, Lieutenant Karl Fischer, was a young medical student who had been conscripted into military service before completing his training. Despite his limited experience, Karl had proven to be remarkably capable under the extreme pressures of battlefield medicine, learning advanced surgical techniques through intensive experience that would have taken years to acquire in civilian practice. The operating theater was a converted chapel in the monastery's southern wing, chosen because its thick stone walls provided marginally better protection from artillery fire than other parts of the building. Religious frescoes still adorned the walls, creating a surreal contrast between the sacred artwork and the brutal medical procedures being performed beneath them. The room was lit by oil lamps and candles, providing barely adequate illumination for complex surgical procedures that required precision and steady hands. As Heinrich began the chest surgery, an Italian artillery shell struck the monastery's northern wing with a deafening explosion that shook the entire building. Dust and debris rained down from the chapel ceiling, while the shock wave extinguished several candles and caused surgical instruments to fall from their positions. The young soldier on the table convulsed from the shock, nearly destroying the delicate surgical access Heinrich had created. "Commander, we must evacuate the patients," Karl shouted over the noise of continuing explosions. "The Italians are targeting this position specifically. Another direct hit will bring the entire building down." Heinrich understood Karl's assessment was completely accurate. The monastery was receiving concentrated artillery fire that would eventually result in complete destruction of the facility and deaths of everyone trapped inside. Military protocol dictated that medical personnel should evacuate when their positions came under direct attack, prioritizing their own survival so they could continue treating casualties at safer locations. But Heinrich also knew that evacuating the hospital would condemn dozens of critically wounded soldiers to certain death. Many patients were too severely injured to be moved without killing them, while others were undergoing surgical procedures that could not be interrupted without fatal consequences. The young Austrian soldier on his operating table would die within minutes if the chest surgery was abandoned before the hemorrhaging could be controlled. The decision Heinrich faced was both medical and moral. As a physician, he had sworn oaths to preserve life and provide care to patients who needed treatment. As a military officer, he had obligations to follow orders and protect medical personnel under his command. The tension between these competing responsibilities created an impossible situation where any decision would result in deaths and suffering. Have you ever faced a choice where both options seemed equally wrong? Heinrich's response to the crisis reflected both his medical training and his understanding of the fundamental principles that should govern physician behavior during wartime. Rather than ordering a general evacuation that would save some lives while sacrificing others, he gave his medical staff the choice to evacuate or remain based on their own assessment of duty and personal courage. "Anyone who wants to leave should do so immediately," Heinrich announced to the medical personnel working throughout the hospital. "I will not order anyone to remain in a building that may collapse at any moment, but I am staying to continue treating patients who cannot survive evacuation. Those who choose to remain with me should understand that we may all die here." The response from Heinrich's medical staff was immediate and overwhelming. Every doctor, nurse, and orderly chose to remain at their posts, understanding that their departure would condemn dozens of wounded soldiers to unnecessary deaths. Their decision reflected the extraordinary dedication to medical duty that characterized the best military medical personnel, who placed patient care above personal safety even when facing almost certain death. With his staff committed to remaining despite the ongoing bombardment, Heinrich returned to the critical chest surgery that had been interrupted by the artillery strike. Working with remarkable precision despite the chaos erupting around him, he identified the damaged blood vessels, controlled the hemorrhaging, and began the delicate process of repairing the young soldier's torn lung tissue. The surgical procedure required over an hour to complete, during which time Italian artillery continued to pound the monastery with devastating accuracy. Several shells struck the building directly, causing portions of walls and ceiling to collapse and creating additional casualties among patients and staff. But Heinrich maintained absolute focus on his surgery, understanding that losing concentration even momentarily could result in fatal errors that would waste the young soldier's last chance for survival. Karl provided exceptional assistance throughout the operation, anticipating Heinrich's needs and maintaining perfect coordination despite the artillery bombardment that threatened to destroy the entire facility. His hands remained steady as he held retractors, passed instruments, and monitored the patient's vital signs, demonstrating courage and professional competence that far exceeded what anyone could reasonably expect from a medical student operating under such extreme conditions. Share your thoughts in the comments below about performing with such precision while facing imminent death. The successful completion of the chest surgery represented only one small victory in what had become a desperate struggle to provide medical care under impossible conditions. Throughout the hospital, other surgeons and medical staff were performing similar procedures while artillery shells continued to explode around them. Each medical team racing against time to save patients before the building collapsed completely or Italian forces overran their position. Heinrich moved immediately to the next critical patient, a German infantryman who had suffered severe abdominal wounds from shell fragments. The injuries had damaged his intestines and created internal hemorrhaging that required immediate surgical intervention to prevent death from blood loss and infection. Under normal circumstances, such complex abdominal surgery would require several hours in a fully equipped operating theater. But Heinrich would have to complete the procedure in a partially destroyed chapel while artillery fire threatened to kill everyone in the building. The abdominal surgery tested Heinrich's skills even more severely than the previous chest operation. The intestinal damage was extensive, requiring careful identification of all perforations and precise repair techniques that would prevent fatal infections. The procedure demanded absolute concentration and steady hands, qualities that became increasingly difficult to maintain as exhaustion, stress, and the constant threat of violent death accumulated throughout the day. As Heinrich worked on the abdominal surgery, he became aware that the artillery bombardment was intensifying, with Italian gunners apparently concentrating their fire on the monastery in a deliberate attempt to destroy the medical facility. Shells were striking the building with increasing frequency, causing progressive structural damage that threatened complete collapse at any moment. Lieutenant Fischer approached Heinrich with urgent news that confirmed their worst fears. "Commander, scouts report that Italian infantry is advancing toward our position. They may reach the monastery within the hour. We need to prepare for evacuation or possible capture." The approaching Italian forces created a new dimension to their already desperate situation. If Italian troops captured the hospital, wounded Austro-Hungarian and German soldiers would become prisoners of war, while medical staff would face uncertain treatment depending on Italian commanders' attitudes toward military medical personnel. More immediately, any fighting around the monastery could result in additional casualties and complete destruction of the facility. But Heinrich also understood that evacuating now, after choosing to remain during the artillery bombardment, would represent an abandonment of the principles that had motivated his earlier decision. The wounded soldiers under his care deserved medical treatment, regardless of changing tactical situations, and their lives remained his primary responsibility as their physician. Heinrich's decision was to continue medical operations until Italian forces actually entered the monastery, providing care to as many wounded soldiers as possible during whatever time remained available. This choice reflected his understanding that physician responsibilities transcend military loyalties and political considerations, requiring dedication to preserving human life regardless of nationality or battlefield circumstances. Let us know in the comments what you think about such unwavering commitment to medical duty. The abdominal surgery required 3 hours to complete, during which time the tactical situation deteriorated significantly. Italian artillery fire had caused additional structural damage to the monastery, while approaching infantry forces were engaging Austro-Hungarian rearguard units in firefights that were moving steadily closer to the hospital position. But Heinrich's surgical team successfully repaired the German soldiers' abdominal injuries, controlling hemorrhaging and repairing intestinal perforations with techniques that represented the highest standards of battlefield medicine. The successful completion of such complex surgery under catastrophic conditions demonstrated the extraordinary skill and dedication that characterized the best military medical personnel during World War I. As Heinrich finished the abdominal operation, Italian infantry units entered the monastery compound, having overcome the last Austro-Hungarian defensive positions. The sudden appearance of Italian soldiers created immediate panic among wounded patients, who feared they would be killed rather than taken prisoner, while medical staff worried about how Italian commanders would treat enemy medical personnel.
The Italian officer who entered the surgical chapel was Captain Giuseppe Romano, a medical officer who commanded the regiment's aid station and understood the international conventions governing treatment of military medical facilities. Upon seeing Heinrich and his staff continuing to provide care to wounded soldiers despite the Italian advance, Romano immediately ordered his troops to secure the position without interfering with ongoing medical operations. What followed was one of the war's most remarkable demonstrations of medical professionalism transcending national loyalties and military considerations. Italian and Austro-Hungarian medical personnel began working together to treat wounded soldiers from both sides, sharing limited supplies and coordinating surgical procedures that would save lives regardless of uniform or nationality. Heinrich and Captain Romano developed immediate mutual respect based on their shared dedication to medical principles that existed above political conflicts. They coordinated the treatment of the most severely wounded patients, with Italian medical personnel providing supplies and additional surgical assistance that enabled Heinrich's team to continue operations under significantly improved conditions. The collaboration between enemy medical personnel in a partially destroyed monastery, surrounded by dead and wounded soldiers from both sides, represented everything that was best about the medical profession during humanity's most destructive conflicts. The physicians and nurses who worked together that day demonstrated that healing could transcend hatred, and that professional dedication to preserving life could overcome even the most bitter military rivalries. The joint medical operations continued throughout the night and into the following day, with Austro-Hungarian medical personnel and Italian medical personnel working side by side to treat over 200 wounded soldiers from both armies. Heinrich performed 16 major surgical procedures during this period, saving lives that would have been lost without the medical cooperation that had emerged from the chaos of battlefield conditions. Captain Romano later wrote in his official report that Heinrich's dedication to continuing medical operations during the artillery bombardment represented, quote, the highest standards of medical courage and professional excellence, unquote, and recommended that his actions be recognized despite the fact that he was an enemy officer. This recommendation reflected the unique bonds that could be developed between medical personnel who shared common dedication to healing even during warfare's most brutal phases. Heinrich remained at the monastery for 3 days following the Italian capture, continuing to provide care to wounded soldiers until all critical patients had been stabilized and arrangements had been made for their evacuation to proper hospital facilities. He was then taken prisoner and transported to an Italian POW camp specifically designated for captured medical personnel, where he continued treating wounded prisoners throughout the remainder of the war. The surgeon's experience at Caporetto became legendary within military medical communities on both sides of the conflict, representing the extraordinary dedication to medical duty that characterized the best physicians and nurses who served during World War I. His decision to continue operating during artillery bombardment and his willingness to collaborate with enemy medical personnel to save lives demonstrated that professional medical ethics could transcend even the most intense military conflicts. After the war ended, Heinrich returned to Vienna, where he resumed civilian medical practice, specializing in trauma surgery and teaching young physicians about the techniques he had developed during 4 years of battlefield medicine. His experiences at Caporetto influenced his approach to medical education, emphasizing that physicians had obligations to provide care under all circumstances, regardless of personal danger or political considerations. In 1925, Heinrich was invited to speak at an international medical conference in Geneva, where he reunited with Captain Romano and other military medical officers who had served during the war. Their reunion was deeply emotional, representing the completion of healing processes that had begun in a destroyed monastery where enemies had become colleagues, united by dedication to preserving human life. Dr. Heinrich Bergmann died in 1956 at age 77. Having devoted his life to advancing trauma surgery techniques and training physicians who would carry forward his commitment to medical excellence under all circumstances. His surgical instruments and medical journals from the war years are now displayed in the Austrian Military Medical Museum, serving as reminders of the extraordinary courage and skill required to practice medicine during humanity's most destructive conflicts. The monastery at Caporetto was eventually restored, and converted into a memorial commemorating the medical personnel from all nations who served during World War I. A plaque in the former chapel where Heinrich operated during the artillery bombardment honors physicians and nurses who maintain their dedication to healing even when facing death, demonstrating that medical compassion can transcend the hatred of warfare. Today, Heinrich's story is taught in military medical training programs throughout the world as an example of how medical personnel should conduct themselves when facing impossible choices between personal safety and patient care. His decision to continue operating during artillery bombardment and his willingness to collaborate with enemy medical personnel to save lives represents the highest ideals of the medical profession applied under the most challenging circumstances imaginable. Dr. Heinrich Bergmann proved that individual courage and professional dedication can preserve life and maintain human dignity even during warfare's most brutal moments. His legacy reminds us that the most important battles are sometimes fought not with weapons, but with surgical instruments wielded by physicians who refuse to abandon their patients regardless of personal danger or military circumstances. If you enjoyed this story, please like, subscribe, and leave a comment to share your thoughts.